hospital can be an intimidating place for children and can have negative effects on their physical and emotional health and well-being. As members of the healthcare team, Child Life Specialists use developmentally appropriate play, language, and support to help children and their families navigate their healthcare experiences.
We have 11 Child Life Specialists who serve many different areas of the hospital. Our education and training equip us with the ability to look at experiences through the lens of children, anticipate common developmentally based fears and misconceptions, and identify and remove potential stressors. A Child Life Specialist must have a minimum of a bachelor's degree in child life or a related field of study. All certified Child Life Specialists must complete a supervised 600-hour clinical internship, pass a national examination, and adhere to professional development standards in order to maintain certification.
As Child Life Specialists, play is at the center of everything we do. Play facilitates healing, encourages self-expression, and is vital to a child's growth and development. We use play in a number of ways.
Child Life Specialists use medical play to help children become familiar with the medical equipment. Medical play can give us a window into a child's thoughts and feelings about their medical condition and the care that they're receiving.
Therapeutic play encourages self-expression, helps children process emotions and become more comfortable in their environment, and can help them achieve treatment goals.
Cause I can't tell.
You can't tell?
Nope.
Child Life Specialists use normative and developmental play to help create a sense of normalcy in the hospital and help children reach developmental milestones. We engage patients with toys and activities they enjoy so that kids can still be kids even when they are hospitalized.
One way we help children cope is by preparing them for their medical procedures they may have while in the hospital. We use developmentally appropriate language, pictures, medical play, all geared towards that patient's individual needs. Along with that, we always encourage their questions, which can reveal their misconceptions about the procedure. This preparation helps us to have them feel confident and safe, and then even a sense of mastery over their fears.
In addition to preparation, Child Life Specialists often stay with patients throughout the procedure to provide ongoing support. We help patients create a personalized coping plan to identify appropriate comfort positions, as well as both medical and non-medical pain management techniques.
That wasn't so bad.
I know, that's the thing. Look. Wow.
Child Life Specialists also provide age-appropriate information about a new diagnosis. This helps the child feel a sense of control over their situation, leading to increased awareness and positive coping with their diagnosis.
It is vital for families facing a terminal illness or coping with a recent loss to understand grief, death, and how it impacts family members of all ages. Child Life Specialists provide grief and bereavement support for both patients and family through memory and legacy making. We also provide support for siblings and children of adult patients.
Family presence during hospitalization makes children immediately more comfortable and decreases stress and anxiety for the patient and the family. Child Life strives to create an environment that not only welcomes the entire family unit, but partners with them to improve the patient's overall experience. Child Life Specialists use evidence-based, developmentally and psychologically appropriate interventions to reduce fear, anxiety, and pain in pediatric patients, reduce the risk of trauma, and increase patient cooperation, leading to more positive healthcare experiences.